I want to thank Bob Grove for organizing this, and I want to thank all the guests that are going to be speaking today. And so, Bob, I'm going to turn it over to you to kind of lead the charge here.
Hey, thank you, Bill, and thank you to the KKFI listeners joining us tonight. I'm Bob Grove, your host. We're here tonight to talk about the impact of pandemic, how we got here, how we're coping with it, and hopefully where we go from here. Joining us tonight are a number of people that are in the trenches on the front lines. I mean, they're working with a variety of communities facing the pandemic. We have Alfredo Policol, who's the Director of Case Management at Hope Faith, Jocelyn Todd, who's the Midwest Manager with NeighborWorks America and formerly the lead community organizer with El Centro. We have Joseph Leitner, who's the Program Director for UMKC's Bachelor of Science in Public Health and formerly with the Kansas City, Missouri Department of Public Health. Kathy Costello, who's a licensed clinical social worker. She has practiced with Western Missouri Mental Health, Midwest Research Institute, Crittenden Children's Hospital, Menorah Medical Center. She was Program Director at Research Psychiatric Center, and she's now in private practice. We also have Roger McCrummen, who's the Managing Partner of the McCrummen Immigration Law Group, and Victor Doherty, who's the Director of the Temple Buddhist Center at Unity Temple on the Plaza. Hello, everyone.
Hello.
Hi. Hi, Bob.
So basically, we're here to talk about COVID-19. And, that's our shorthand for the novel coronavirus pandemic of 2019. Several terms there that I want to unpack just so we're talking about the same baseline. When we talk about a novel virus, that's a new or emerging virus. New being a mutated form of a previous virus, or an emerging virus is one that has come out of a habitat and moved into new habitats where the residents of the habitat don't have a defense system against it. Interestingly, this is where pandemics intersect with the environmental and climate issues we're expecting, because both of these, both climate issues and pandemics are accelerated by commercial animal agriculture and habitat destruction. So I think we'll be looking at a few of those interrelations as we go through the evening. Coronavirus, as most of us know, that's the common cold. That's a family of viruses. So that's everything from the sniffles to life-threatening viruses like we're experiencing with this novel version of coronavirus. And the idea of pandemic, which is a worldwide infection of a zoonotic disease. Now that's a word you may not be familiar with, zoonotic. You can think of going to the zoo, which is about animals, or zoology, where we study animals. A zoonotic disease is one that jumps from an animal, typically a wild animal, to a human. It's a virus that's moving from an animal to a human, often through an intermediate host. And I believe that most of our major pandemics have all been zoonotic diseases. So of the pandemics we're going to talk about in general, and COVID-ID specifically, we're primarily looking at the flu virus and the cold virus. The influenza pandemic of 1918, we're hearing a lot of talk about that. And that's a virus that actually originated with chickens, a chicken and pig farm in Kansas. That was a virus that jumped from the chicken to the pig and then infected the farm workers. And then from there, it went to Fort Riley, Kansas, and then deployed to Europe with the soldiers going over for World War I. So we're seeing this zoonotic disease that jumps from one animal to another to humans. We see this again, and that influenza, that flu virus that so often recurs, because we had influenza epidemics in the 50s and the 60s, and all of us remember the H1n1 flu pandemic in 2009. That was the same H1n1 that was back in 1918, but through commercial animal farming, it had mutated and become more virulent. More people died this second time around. But what we're dealing with this time is the cold virus. We've seen several pandemics recently, just the last couple of decades. We saw SARS in 2002. That was a cold virus that transmitted from bats to civet cats to humans. And then MERS cropped up in 2012, Middle Eastern Respiratory Syndrome. And MERS seems to be coming back annually. That's a virus that again originated with bats, somehow transmitted to camels, and then from camels to humans. And now we're looking at COVID-19. And most of the research is saying that also originated with bats and transmitted through pangolins, which is a small anteater-like animal, and then to humans. And what these all have in common is kind of the wet markets, the animal processing plants. The fact that we're taking viruses that live naturally in the wild, and they're migrating and mutating through our animal processing and reaching humans. So those are some topics that we can address as we go around the table. But let's talk about how we're coping with this pandemic, this COVID-19 that we just recently acquired. Let's start with Joy, if you don't mind. Joy Leitner, previously with the Kansas City, Missouri Public Health Department, now with UMKC. Joy, how are your people coping with the virus?
Well, thank you, Bob, for having us tonight. You know, public health, this is what we do. This is why we're here. You know, I think our public health units in Kansas City and the Metro have done a really good job of leading the charge, you know, to combat COVID-19. You know, I think it's really important to thank those public health workers, everybody who's doing contact tracing, to nurses who are on the front line. We have a faculty member in the School of Nursing and Health Studies, Dr. Sharon White-Lewis, who is leading the medical response team for the Kansas City metro area. And, you know, I think it's also really important to think of, you know, public health is not just the health department. It includes individuals like Mayor Quentin Lucas, who I think has done a really good job of responding to, you know, the virus and giving us all appropriate mechanisms to, you know, prevent transmission. From a university perspective, in public education, you know, our faculty, we have had to transition everything online, and teaching students online is a difficult thing, but I think our institutions have really innovated their way out of the problem. We were thinking very creatively to teach complex issues. You know, in public health, we're kind of used to this environment where we have to be a little creative and kind of work within the bounds that we have. But, you know, our folks over on Volker campus who, you know, teach labs and stuff, they've really kind of innovated their way into a kind of a new era of education. And that goes along with our primary and secondary folks at KCPS, you know, everything from giving kids hotspots so that they can, you know, connect to internet if they don't have internet at home, really reducing that digital divide that we have in Kansas City, and really like moving the field forward. So I think as a whole, you know, public health, of course, is used to these kind of things and is used to managing these complex systems. And I think in Kansas City, we're doing a really good job. That, of course, has shown by the numbers. You know, we have not been hit near as hard as some of our like cities. So, of course, there are cons. You know, I think in Missouri is an interesting state. In Kansas City, of course, half the city is really in Missouri. Public health has been underfunded for years, right? So public health and institutions of higher ed, you know, there's only so much we can do with the amount of funding, but really the lack of funding that is available. If you think of Missouri is really at the bottom of states that fund public health. We get very, I think it's $19 per capita of federal funding for public health, and really pennies per capita for state funding for public health in Missouri. KCMO, of course, is different. We have a health levy tax. So if you live in Kansas City, Missouri, your property is taxed for the purposes of public health, health care, ambulance services. And of course, the city thanks you for those tax dollars. And that's really one of the reasons that we have been able to cope a little bit better is because the public health infrastructure in KCMO is it's pretty good. We have, I don't know if you guys know this, but the City of Kansas City, Missouri Public Health Department is a Robert Johnson Culture of Health Prize winner. They have been Mid-Sized Health Department of the Year twice in the last 5 years, I believe. And so they're doing a really good job of protecting the public's health. So overall, Bob, I think that we're moving in a good direction. I think we have some space to grow, as always. Kansas City, we have major equity issues in Kansas City, and things don't affect everyone the same way. We have about a 15-year life expectancy gap within just a couple miles. So if you think of, UMKC main campus, on the west side of main campus, folks live about 15 years longer than they do on the right or on the east side of main campus. So COVID-19 is impacting individuals about the same way. People who have access to resources and can get healthcare are living and being less affected than folks that already have some conditions like heart disease, diabetes, hypertension, that then have downstream effects when they're infected with a virus like COVID. They just don't do as well when they get to the hospital, and they often don't get to the hospital at the same time. And there's all of the kind of issues associated with that. So, we have room to go in terms of equity, but I think that we're on the right track, and we'll see what happens.
How are your students coping with this transition?
Great question. Yeah, our students are resilient. UMKC is different than a lot of different state schools. So the populations that UMKC serves is really different than the population that Mizzou, KU, K-State serves, right? And so, we have some issues. If you think of students, everybody's off campus now. We've completely closed campus. Everything is online. This week is finals week, so they got one more day until they can really leave, get away from classes. What we have learned is that students who went home, they don't have room to study. They get interrupted a lot. Everything is kind of harder. Maybe their internet's not the best. There's all of those kind of issues that we've had to really overcome. But I can tell you that, our students, they are a resilient bunch, and they figure it out. And, our resources on campus have really helped students kind of overcome those challenges. So
I would welcome everybody to join this conversation. If you've got questions about campus or Joy or anything, please join in. Kathy, I know you're working in the mental health profession, and there's kind of that tie-in between students. We were talking earlier, and you were discussing about people being isolated. And do you want to discuss that?
Well, the isolation from lockdown is certainly affecting people negatively. Of course, my population already is vulnerable going into the pandemic, but the isolation is increasing loneliness, depression, anxiety at multiple levels. Just the personal one, and then the family connections that are minimized or cut, and loss of financial security is a big one, and loss of a sense of safety in the community resources. People, even at the top level, not being sure their government is representing them in this crisis. Whichever side of the spectrum they're on, they all tend to believe that the government is not doing the right job right now. So there's a lot of struggling with losses through the lockdown.
And how are you coping? I assume that you quit. I should ask this question. Are you still seeing patients in person, or did the lockdown force you to shut your office?
Well, one of the benefits of my field in terms of healthcare is that we are able to do things online. We don't have to be a hands-on kind of a therapy. So I think everyone, or most people, are doing therapy online. I certainly am. I was I was reluctant to do this in the first place because, number one, therapists aren't noted for being good technical people. So I had to learn, and I know a lot of my colleagues did too. And secondly, I felt it wouldn't be effective since you weren't right there with them. But I'm finding that it does work surprisingly well. It's probably one of the techniques in my field that's going to go on when the pandemic survives, because it is a way to get therapy if it isn't available to you, and it's very effective.
Yeah, I got a question. It occurs to me that there's lots of different ways of developing anxiety over this. There's the lonely aspect that you talked about.
Mhm.
There's the health aspect that's, scares everybody. And then there's for the family. Then there's the whole livelihood thing too. So there's kind of a yin and yang about anxious if you don't open up and anxious if you do. So I don't know if you can comment on, which of those you see the most of, or if there's any way to gauge that.
Well, I think I see almost a universal increase in anxiety, or what I would call fear, actually, especially since people there's so much contradictory information. They don't know what's going to happen with the pandemic. They don't know who in their family or people they know are going to contact this. So that uncertainty really increases anxiety, and anxiety tends to go hand in hand with depression. And certainly none of us go to good places in our heads if we are alone too much. Introverts are doing pretty well with it, actually. My daughter's an introvert, and I said, "How are you doing?" She said, "I was born for this, Mom."
That's my daughter.
I see the extroverts really suffering from their loss of contact with other people.
How important do you find that physical contact to be as a therapist?
Well, 80% of communication allegedly is nonverbal. So there's a lot that a therapist reads in their physical presentation, how they walk, all of the physical stuff. So that is fairly important. Being able to see them on the Zoom or whatever application they're using tends to help with that. I think a lot of people would feel that they need to be in person. But I think there are a lot of people, especially young people who are so technically savvy, would find this method just very accommodating to them.
As a therapist, are there specific techniques or suggestions you could give all of us on coping with the pandemic, with the stress?
Well, this kind of situation leads people to feel helpless because they can't predict. So their anxiety is really escalated. We imagine all kinds of things when we're anxious, and they very rarely come true. Mark Twain said, 80% of the bad things that happened to me in life never happened. And that's pretty true with anxiety. So we are thinking about the future. We are planning for things that may not ever happen. We need to recognize we don't have a lot of control in life. We don't have a lot of control over the situation. We do have control over ourselves. And people have thrived for many millennia with much more difficult situations. I think one of the things I hear from patients is, I'm so lucky I'm not in a third world country, or, there's a kind of gratitude that people are feeling now, recognition of the basics in their life. And I think focusing on what's happening now, focusing on the little things in our lives, which seem little, but they're really not. Someone saying, I love you, a good meal, sunshine, those are all what make life living worthwhile.
That's good advice.
I just have an observation, which I'm just curious your thought on it, that I wonder if the wearing of masks and gloves is at least partially a therapy of having control over things a little bit. So, I mean, there's a lot of people who don't do it, but I know for me, at least, I feel like I'm doing something by doing that. So I don't know what your thoughts on that are.
I agree. I think that you've got a good point. That makes a person feel like they are doing something. And we need to focus on what we can do. Wear the mask. The people who are protesting, wearing the social isolation, are engulfed with fear in terms of using a lot of denial. But if you're doing what the social isolation requires or suggests, you are doing what you can do. And that's a good thing to focus on.
Joy, I'd ask you a similar question. I mean, coming from the public health sector, I mean, what's your recommendations? How do you advise us to cope?
Yeah, great question, Bob. So first and foremost, I think social distancing is a very valuable term. We don't want to socially isolate, right? So we need people, we need social connection, and we need to maintain a safe distance from people. That's how disease transmission spreads, right? It spreads through behavior. You still need to remain connected to your friends and family, however that is, right? If it's through Zoom, if it's by calling people, texting, however that happens. We're pack animals, and just a little bit of research. Social integration is how often, it's this technical term of how often we see our family and friends. It's a better predictor of mortality than smoking. So people who are lonely, socially isolated, they are much more likely to die of both chronic and infectious disease than individuals that are socially connected. So I think that's really important to note. Also, you know, I'm a physical activity researcher. This is an excellent time to be active. I know it's kind of tough sometimes. You don't want to go to the park. You don't really, I mean, going to the park is valuable as long as you maintain social distancing. If you're in an open air environment, it's pretty tough to contract the virus, especially if you remain, you know, 6 feet away from individuals. But like going, walking around your neighborhood, if you have a dog, you know, taking your dog for walks every day. You know, if you want to take up jogging or biking or any of those kind of activities, now is a really, really great time to do that. The weather is pretty decent. It's not horrible all the time. It's not super hot. It's not super cold. And if you can do that with individuals in your household, that's even better. We know that if FYI, multiple behavior change, if you want to start a new healthy behavior, it's much easier to do it with individuals than it is to do it on your own. Again, you want to do it with people who you're already connected to, who live in your household, who you're already exposing and exposed to, right? But right now is a great time to kind of take your behaviors in your own hands and do those things that you've been wanting to do.
You make several good points, and there's all kinds of evidence that physical activity reduces anxiety and depression. And I see that if people can increase that, they'll be better able to cope.
And there's something about just like going for a walk is something that's normal now. With all the abnormal stuff that's happening, wearing masks and not being able to do things and working at home, something about like going for a walk around your neighborhood is a normal thing that we can all do. And then of course, there's always the beneficial effects of being in green space and around trees and nature and those kind of things that are beneficial.
Alfredo, I'd like to invite you to talk. I really admire the work that you and Hope Faith are doing with the homeless community. And obviously this pandemic must really impact them drastically.
Absolutely. Thanks for having me, Bob. So for folks who aren't familiar with Hope Faith, we are KCMO's only daytime resource center for folks experiencing homelessness. And so when the coronavirus started making news in late February and March, we really started paying attention just because there wasn't any particular precedence for how homeless service providers, homeless shelters could act and respond towards the coronavirus. And so we really started paying attention as early as late February and early March, just because we don't have the option of shutting down. We knew that we have a particularly vulnerable population, doesn't have access to food, doesn't have access to hygiene, doesn't have access to a lot of services that folks take for granted, but more importantly, don't have the option to shelter in place. And so, and that's one thing that we do at Hope Faith. We're a collaborative day center. We offer all those key resources. So one of the things, working super closely with Veterans Community Project, Greater Kansas City Coalition to End Homelessness, Care Beyond the Boulevard, Heart to Heart International, we were able to sort of have a coordinated response as quickly as possible. So when the lockdown order, stay-at-home order started to come in place, we knew that we needed to create a safety net. And again, there was no guidance around this. We were looking to other communities. We were looking to Seattle, where there was the first sort of infection. We were looking at what was going on. And so we were very much learning how to approach this as we went. And so our facility is a 47,000 square foot facility. We were able to, in order to protect both our staff and the community we serve, we were able to transition that outside, coordinating closely with the city. We basically created an outdoor resource village. We were able to set up wash stations, bathrooms, and then with Heart to Heart coming on board, we were able to actually set up an extended medical clinic to be able to kind of provide those key services. But early on, I think one of the things that we had to do with our community was get information out to those experiencing homelessness. Things that we talk about in terms of technology inequity, all the information that's going out over social media, over the web. A lot of folks who are in encampments don't have those technology options. And so we really had to shift gears and put our sort of community health promotion hat on and get out into the streets with flyers, get out information about what is the coronavirus, what is social distancing, how do you protect yourself. And so we were very much early on, because we also, with our particular population, we have folks who have behavioral health issues, substance use disorders, cognitive disorders. And so being able to engage those individuals and hopefully change behaviors to protect our community. And so it's really, really great that we had such a coordinated effort with so many of our partner agencies, great restaurants like the Rieger, Operation Barbecue, helping us provide meals. So we went from serving meals we typically do indoors, where we're doing about between 200 to 300 meals a day, to upwards of 500 meals every day. And so, and then with that, we were able to closely work with the Homeless Coalition to set up a quarantine, and now we have an isolation set up. So in the event of a particular surge, we're set up for all that. And so we've also have testing on site for the community who is symptomatic. We're looking to expand that as testing becomes available. So as a community, we've done, I think, the best we can as far as ensuring those who are particularly vulnerable don't become more vulnerable. And with that, when we're talking about sort of the communities we serve, the immediate impact that was felt from sort of the stay-at-home orders was the suspension or shutdown of really critical resources. A library is a great example, a place to be able to access technology, be able to connect with folks. For good reasons, the library shut down. A lot of the outreach services suspended their services, so access to behavioral health, access to prescription meds. Those were very much early on. And so I think what's great as a community is we've all been able to pivot, find ways to utilize technology, utilize sort of the entry point that we have at Hope Faith, be able to proxy for a lot of those services. And so we've in the first 30 days of sort of the stay-at-home order, from starting around late March to middle of April, and obviously we're in May already, we saw over 1,200 unduplicated individuals come into our resource village for services. And so I think the long-term impact that we're starting to see now is sort of those suspension of services, the lack of access to behavioral health. And so when we talk about a lot of folks who can access it due to technology, we have folks who are on the streets who don't have the ability to teleconference. And so we've been able to set up technology a sort of stopgap at Hope Faith to be able to teleconference with folks. But obviously that's not the best sort of solution, but it's a stopgap, and really trying to figure out ways that we can kind of bridge those services, be creative, and really figure out solutions. So fortunately, we haven't had an outbreak within our homeless community, which I think is pretty amazing when we kind of look at Boston and some of these other places where in congregate living situations that they've had outbreaks of coronavirus. And so in the isolation motel where individuals who are experiencing homelessness and who have been ill and are waiting tested, over 30 patients have been seen over there, but fortunately no one has tested positive. And so I think that's a good sign of kind of the health of our overall community. And more importantly, the fact that I think our community, we were able to react as quickly as we could in terms of realizing that this was a vulnerable population. How do we ensure that this population is protected and continue to have those resources that they need? And so the big concern now, and I think that we're all looking at, is sort of the economic impact. What is this kind of next wave of folks who potentially are now becoming, potentially are vulnerable to becoming homelessness? We know that there's quite a bit of job loss. A lot of people have been furloughed, folks who haven't maybe paid rent for the last 2 months. How do we begin diversion or prevention of that? And so that's kind of what we're looking at, is sort of the long, kind of drawn out impact of all of this over literally the next couple of years.
Are you still accepting donations of goods?
Yes, yeah, absolutely.
I was curious. Yeah, I have a question as well. I just, you know, when you mentioned that the public libraries are closed, I'm thinking, well, that might be some of the spaces that were used before by some of these folks. Mm-hmm. Even with the 47,000 square feet you talked about, is there a larger demand for having shelter for these folks with everything closed, or? Yeah.
And so kind of the existing shelters that we have, City Union Mission, Shelter KC, they did an excellent job also implementing protocols. And so part of that was reducing the amount of shelter beds in their particular spaces. And so I think there's some good, fortunate timeliness in terms of when this is hitting, as the fact that it is kind of warm out and it is spring, where if this had hit during the middle of winter, we would be in a very, very scary situation, because we're already facing folks who are unsheltered, dealing with hypothermia, those elements, and figuring out a solution for that. And so that's kind of our kind of next step in trying to look upstream, is what is fall and winter going to look like as far as the health of our community. How do we kind of manage the services we have in a way that we can be as safe as possible, minimize potential outbreaks, and if there are outbreaks, how do we contain them in a way that we can mitigate further spread?
Something I'd like to add to Alfredo's comments is, I think that a lot of the stopgap, or maybe a better term might be the relief valve, a lot of the churches that were, here at Unity Temple, we would get anywhere from 3 to a dozen homeless folks a day who would stop by, and they'd use restrooms, they get water, they'll get little care packages that we have, things like that. The churches are closed. And
absolutely.
That's a double whammy for Alfredo's programs. There's just no, and with the traffic drying up on the streets, we would see the homeless folks on the corners down here on the plaza all the time, and there's no traffic. Mm-hmm. And so there's just literally every possible resource for a lot of our homeless communities have just dried up. So right. It's really very, very important to be focusing on that, I think, at this time.
So Gio, jump in here. I know you're community organizer, immigrant communities, and undocumented. Tell us a little bit about that, how that's tying in.
Thank you, Bob. And first, I want to say, Alfredo, wow, what an amazing job. Definitely. Thank you for everything that you're doing. That's amazing. And And as far, yes, you know, I've done a couple of different experiences here in the community. As you mentioned before, I was previously the lead community organizer at the Centro. And right now I'm still staying active outside of my work with different organizations that I was able to tie in. And I first want to say that they're doing amazing work. And some of the things that they had to react to was, first and foremost, was the lack of access to resources as well. With the immigrant communities, one of the first things that comes to mind is that if they are undocumented, they have no IDs, or they have, you know, no insurance. They don't get stimulus checks. If they don't have a job, if they get laid off or furloughed, they don't get anything, and they're trying to figure out how to do it. So to begin with that, because there is a gap of finance for some of the families, that's what's looking into them into figuring out where can they get that help. So that goes and ties into paying utilities, getting food, having to choose whether you're going to pay utilities or you're going to get food for your family, right? And then it can ripple effect into housing, making payments. Thankfully, this month we've seen a lot of help, but what about the upcoming months if this continues, and what would that ripple effect be like? On top of that, the a lot of the kids here in our communities, you know, had free lunches, and at the moment some of those families are hurting as well. And it always goes back to, as you guys had mentioned previously, I think a lot of the points that Alfredo hit is similar. There is no connection to the internet if they don't have Wi-Fi. Some of our families are living in poverty communities, and there's still a lack of access to many different information that's out there. There's still lack of language, even though there has been a lot of things being translated. But it goes back into organizations like El Centro, like KS Moda, Air, and all these different ones that are doing that type of work to actively translate. Our department here in Kansas, the Kansas Latino and Hispanics Commission Affairs, is doing an amazing job at translating a lot of the things. But it goes back to, are we printing any of those out? Are we putting them in our stores? How many people are actually getting access to all this information that's being interpreted? So that's another thing that we're looking and facing in our communities. Adding on, I mentioned the ID. So those are some things that we're still battling and trying to figure out, how can we get individuals to, you know, not be afraid into going to hospitals and getting the help that they need, not be afraid to go into different organizations that can help them out or guide them into clinics, into different resources like mental health as well. So it all kind of ties together into figuring out how can we advance when we have this limitation already. And then above all, and I know Roger's going to hit on a little bit about this, but there's still some detentions happening. There's still some ICE activity every once in a while. Just recently in KCMO, there was a detention center that was in talks of getting built. And thankfully, that was something that was retrieved just this past week. But it had been ongoing talks and ongoing, you know, conversations of figuring out whether they were going to come or not. On top of that, we still have individuals, like I said, if they get picked up, they're still going into the detention centers. And that's still a very, you know, situation that there's a lot of work that still needs to be done. There's amazing organizations like DDLN that is doing amazing work, but we all need help, and we need more hands on deck, right? And at the very end, there's still things that are, again, I know Roger will hit on some of these points, but there's still a lot of immigration pathways that have been limited because of the COVID. There has been a lot of individuals who have either stopped midways in their progress, or it goes back to finance. How can they continue to pay their, you know, their lawyer or their progress? Because the applications are expensive as well. And if there is no job, if there is no stimulus check, there's nothing behind them that's helping them out. It becomes a matter of choosing, you know, what you're going to do with what you have. And hopefully it'll be enough for all your family or yourself, depending on the situation that you're in. So those are a couple of things that are going on, and trying to figure out how we can continue to help. School-wise, And I just thought of this, sorry, school wise, that's a whole nother subject of trying to figure out how can we can get resources to these individuals, to these families. How can we make it accessible for Spanish speaking families and other languages that are out there, because it's not only Spanish, right? It's a whole bunch of different languages that we still have yet to figure out how to get connected, how to translate and give it to them so they can understand everything that's going on. We see policies, kind of shifting around, the reopening, the guidelines, and all of that is still things that we need to translate in a vast majority of languages.
So Roger, I'm kind of surprised to hear Dio say that the pandemic's impacting the pathways. What's going on there?
Yeah, well, yeah, there have been several pathways that have been limited because of it. Because there have been travel restrictions that have been enacted in the name of the pandemic. So there is a broad powers for the president to act on behalf of public health concerns, and it's been seldom used in the immigration context, but more so now. It's no. I don't think it'll be a surprise to anybody that this administration has used immigration and immigrants in a negative way from the outset. And if I come across as combative in this, I think that's a pretty universal feeling among immigration lawyers right now. The president's own campaign started out with talking about Mexico sending rapists and murderers, and then there were the Muslim bans and the various attempts to build a wall and divert money from other programs to it, sending troops to the border, fear-mongering about caravans coming to the U.S. There's been a lot of widespread changing of the rules for what qualifies for asylum. There's been a tremendous reduction in levels of refugees admitted to the U.S. That's been standard with the administration, but what's happened now with the pandemic is that it's provided the justification for doing what the administration has wanted to do. So a lot of the measures they've taken in the past have been found to be unconstitutional, but now with, in fact, there was a good article in the New York Times just about a week ago of how many of the measures they've tried to take in the past now are being justified because of the pandemic. So, for example, well, one of the first things I saw when the fear of the pandemic started to arise was that the president tweeted that now we need the wall more than ever, but the wall really had nothing much to do with the virus, but that is the thinking of the administration right now. So there is in effect right now a moratorium on any immigration coming from outside the U.S., any like green card processing at the U.S. consulates abroad. It's not affecting right now the people who are in the U.S. in some sort of status that are applying for their green cards. But there's been an estimate that these kind of measures are going to block a good 300,000 plus immigrant visas because of that. And we've seen there's a travel restriction right now between U.S. and Canada and the U.S. and Mexico for all non-essential travel. But what we also see is that all the consulates are closed. Visas, which are the permission to enter the U.S., are only issued by U.S. consulates abroad. And so we have, for example, executives from major companies that are stuck abroad that can't get a visa, even though they have approvals from the USCIS to work in the U.S. They can't get their visa to come in, and so they're stranded until further notice. And so that's affecting a lot of people, and that have legal rights to immigrate, but their opportunities are being shut off because of the current restrictions. There was that has to do with a lot of it right now. At the border, like we represent unaccompanied minors that have come in and are working with the Office for Refugee Resettlement, and housed by them in shelters. And we've seen those numbers go way down because people are being turned away at the border. So they have international rights and rights under U.S. law to apply for asylum, but because of the public health concerns, they are being turned away and not given the chance to apply for asylum or any kind of refugee status. So that's the elimination of a lot of the pathways that you're referring to. The immigration courts have been shut down. The USCIS, our immigration service, has shut their offices down. They're not having any in-person meetings, and a lot of what happens in the U.S. for legal status is done through interviews at the USCIS offices. They're scheduled to reopen again in June, but that might be extended again. That shut down, and naturalization ceremonies have been canceled. Although we're starting to hear that they're going to try to schedule some more of those in smaller numbers. A lot of times those are very big ceremonies, you know, with a couple of hundred people, and I've heard that they're going to try to have 30 or so with a lot of restrictions on that. But basically, the pandemic has been a means of slowing down legal as well as illegal immigration in the U.S.
Victor, do you want to talk about your faith communities? I mean, obviously you spoke earlier about some of the overlap between the homeless and I assume also the undocumented communities. How are the faith communities coping with the pandemic?
Well, I think what I'll do is I'll kind of divide this up. I mean, there's the first, it's been incredibly difficult because, you know, we're closed. And so the churches are very hard hit because one of the first things to go in a crisis like this is that extra bit of income that people might put towards a charity or might put towards their spiritual communities. So it's been very, very difficult for the faith-based communities, at least in Kansas City, and my friends that I speak with, many of them are all actually, you know, reeling quite a bit. The communities have all rallied to try to move everything online. Many of them are experiencing some success by moving stuff online, various classes, services, worship services, pastoral counseling, those types of things have been able to move online. But of course, as we've already heard from everybody else, not all churches either have the equipment or the knowledge to be able to do that, and not all of the people within the community, within the congregations, have the equipment or the knowledge to do that. So instantly, right there, you've you know, kind of culled the herd, so to speak, as to who has access to the spiritual nourishment, to the pastoral counseling. So we'll try to pick up the slack with phone, and from there we've you know, tried to pick up the slack by trying to meet one-on-one, you know, with some distancing, like we'll meet outdoors in parks, or we have some gardens and things around the temple here. So the community is really struggling to try to reestablish a connection, not only between itself and its congregation, but also amongst the congregation itself, to provide a place of connection and contact. We have, and again, I don't want to, like I said, I'm going to treat this in two phases. So the first thing I'm going to talk about is the impact. We have suffered suicides within our community. Believe it or not, in the past 30 days, we've had 3. So it's horrific. A lot of our spiritual communities also house recovery communities. So a lot of the recovery programs are housed out of churches and spiritual communities, and they can't meet. And this is devastating to a recovery community because it's that weekly, if not daily, coming together of a recovery community that can talk about, you know, and express what they're feeling, and then get that support, get that encouragement that is not happening. And so it has been quite devastating to the community on that level as well. There's a tendency for when you go to church or you physically go to your spiritual community, you generally tend when you go to figure that you're going to put something in the plate. Online, there's a disconnect. It's like, hey, I'm in my pajamas, I'm sitting in bed, I'll give something a little later. And so even though some communities are experiencing actually a little bit of growth in the number of people attending a service, because now it's online, right? It's global. Yet the donations are not there, because people chime in for 10 minutes, 15 minutes. They don't stay for the whole thing. They're at home. What am I giving money for? Listen to a person talk for 10 or 15 minutes, which I do all day long anyway on the computer or on TV. So it's a little bit of a disconnect. So all the way around, it has been quite a struggle. It's been quite a real hit, if you will. Now, let me flip that and say that it has motivated a lot of spiritual communities to beef up what they're doing online, to create other pathways of connecting the community. So in that way, in that respect, it has been better. Joseph talked about creativity and finding new ways to connect. And so that has been better. Kathy was talking about counseling. Pastoral counseling, a large part of that is sensing the person you're speaking with, is sensing their energy and working energetically with them. And that's more difficult over a Zoom or over a telephone. And so it's not quite as effective that way. However, not impossible. As Kathy mentioned, there has been some real progress in working on a pastoral counseling level with people over the Zoom and over the telephone. It is not ideal, but it is better than what we might have had available to us 20, 30 years ago, where you wouldn't have had any of this stuff. So there's some creativity. There are larger audiences finding spiritual and faith communities because they're now, they're global. Also, people are spending more time at home with their families, doing things that they've wanted to do for years, writing the book that they've always wanted to write, or learning to play piano. So there are some wonderful benefits. One spiritual teacher put it this way: everybody's at home with their families, and only God could do that. So people are, there are things that are coming out of this that I think are helping us to see, for example, racism and the lack of equity in our communities for the marginalized groups. This has all been made very, very apparent. It's absolutely in your face, and no one can deny the fact that the African American, the Latino, the homeless communities are being devastated by this, and also families that were living paycheck to paycheck, right, hand to mouth. This disparity has been made absolutely evident. And so I think these are positives to come out for our community, as a country, as a nation, as a people, to see what's been going on that was never brought to light, and this pandemic has brought that to light. And so I think all of these things are, even though this is very tragic and very painful, growth only comes through pain. And so we're growing as a nation, as a country, by actually turning and seeing all of these things that are happening. And there's no way to put your head in the sand now. It's all very, very apparent. And in a way, this is good. This is good for people to see this, to experience this, and to become informed about it.
I think that's very true, that a lot of things have become apparent. And I kind of touched on the intersection between pandemic and the climate issues. And I think it's also become very apparent that they have the same roots, they have the same solutions. If we solve our climate problems, our environmental problems, we're going to quit seeing so many of these massive health issues, and we'll all be better off. I'd like to turn to where we go from here. And we've got about 5 minutes left, so I'd just kind of like to go around the table, and if you can just kind of touch on where you see your sector going next. And if you are providing a service or feel like it, please share with our radio audience how they can reach out to you. So let's start with Joey.
Well, thank you, Bob. I think that we have to talk about a time frame here. This problem is not going away. And we're in it for at least a couple years. This is not going to change drastically until there's a vaccine and until people are vaccinated, right? Which are two very different things. And so I think that the way that we as a community, as a collective, can really really make this a positive thing is to grow through it, and be innovative and be creative and figure it out, right? Work together, work across sectors, do the things that we need to do, and really kind of help each other out and become a really great community that we can all be proud of. I think that it's really important to note that we all know COVID-19 spreads in a social network. So does everything else. Kindness spreads, behaviors spread, right? So if you wear your mask, other people around you are likely to wear their mask too, right? If you become active, other people will likely become active too, right? So there's all of these things spread in a social network. Let's spread the good things. Let's try not to spread COVID-19. And I think, everybody around the table is doing really great work, and thank you guys for all that you do.
Thank you, Joey. Kathy?
Well, I think that therapists in this field will definitely have to up their game in terms of technology. There'll probably be more educational training on conducting therapy with technology, which is, drag us into the 21st century. In terms, I'm sure that mental health is going to suffer. What I'm hoping is that it brings more awareness to the general public of what mental health issues are, and that we have to address them because they won't go away. On a personal level, I think we should all be grateful for where we are. Wonderful organizations talking today, and we can think about helping them. Helping other people makes us feel better. There are things to look forward to in the future, always.
Is there a way for people to reach you if they need to talk to you?
Yes, they can contact me online. My website is kcostello. Just give me a call. There's a phone number on it.
Yeah, I have your website here, kcostello.lcsw.com. Is that correct?
Yes, thank you.
You're welcome. Alfredo.
Yeah, so I think there's going to be this running theme that we're all in this together. This virus can impact all of us. It's not going to be limited to the particular community that we serve. It's going to impact all of us, and it's all of us kind of coming together, thinking through new creative solutions. And we've had this opportunity to have this great pause, if you will. And so there's an opportunity to not go back to what wasn't working, but to really think about what could be working, what should be done. That's what we're doing in sort of our particular set of agencies is reinventing kind of the new system, because everything has been put on pause. Literally all the services have stopped. So how do we improve what we've already been doing, come together, and then really look at the broader community. All our communities are interconnected. And so all of us working together is how we're going to get through this for the long game. And hopefully in that process, we come out with a better community, more resilient individuals, moving forward and not backward through all of this.
How do people reach Hope Faith if they want to help?
Yeah, absolutely. So if you want to learn a little bit more about Hope Faith, you can visit us online at www.hopeffaith.org. hopefaith.org. And then you can find information about how to donate, how to volunteer, get in touch with some of our staff if you have a particular service that you'd like to offer. We're all about collaborating, working together as a community.
Thank you. Jocelyn?
I share the same sentiments as everybody. You know, we all have to be together. We're all going to get through this together, and there'll be better days to come. And as far as where do we go from here, I would say continue to support those local organizations that are doing amazing work right now, just like Alfredo's organization and everybody else's. Donate if you can. I don't know if a lot of organizations are welcoming in volunteers at the moment, but any donation helps. Food donations, money donations for individuals who are giving utilities assistance. There's so many other things that could be brought forward. I think just reach out. Some organizations are El Centro, DDLN, AIR, KS Moda, who's doing DACA applications. McCrummen does a lot of different things as well at low cost. And there's just so many different, I could think of so many organizations, but please look them up. And support them as much as you can, either by donations or just by your voice. Sometimes they're fighting policies. Sometimes they're trying to get the word out and raise awareness. So please join those social movements as well. Everybody, like you said, is in here together.
Thank you. We got about 30 seconds left, so quickly, Roger.
Yeah, I've got a couple of really specific points. I think we could reimagine immigration as a way of benefiting the country and benefiting our health. For example, you hear about all these outbreaks in the meatpacking plants, but there aren't good visas for those people, and yet we've deemed them essential workers, and yet a lot of those are immigrants working in those plants. A lot of immigrants don't go and seek medical help right now because they have a fear of removal. We could take that away. We could consider alternatives to detention. Right now, there's some 800 confirmed cases of COVID-19 for immigrants, non-criminal immigrants in detention. There's alternatives to that. So I think when we think about the economy right now, there's we could let in more health professionals. There's a lot of ways we could look at immigration as a way of benefiting the U.S. instead of looking at it as some kind of drag.
It is what it is. Victor.
And for those of you listening out there in Radio Land, if you're wanting to experience more about mindfulness, meditation, dealing with isolation, or looking for connection, please contact us here at templebuddhistcenter.com. And something interesting to note is that the virus doesn't recognize black, white, gay, straight, Republican, Democrat. If this little single-celled creature could teach us that we're all one, wow, what a great lesson we could take from this.
Thank you, everyone.
Amen.
It's been a wonderful conversation, and I hope to see all of you again soon. This is Bob Grove, and everybody stay safe and be well.
Thank you.
Thank you.
Thank you.